Madam Secretary, welcome. I'd like to concentrate on the cost estimates of the health care law because it's what I concentrated on last year, and there's certainly been new information to surface since then. So I'd like to first start out by just pointing out that when they passed Medicare back in 1965, they estimated out 25 years and said it would cost $12 billion in 1990. In fact, it ended up costing $109 billion, 9 times the original cost estimate. So I don't have a great deal of faith in some of these estimated numbers, and I certainly don't have faith in the estimates for Obamacare. In the President's fiscal year 2013 budget, just released, he's increased the mandatory outlays for health insurance exchanges by $111 billion, from $367 in his last year's budget to $478 billion. Is that correct?
Yes, sir.
Okay. The Class Act, I think we end up recognizing that was not going to work out. That wasn't going to be financially solvent. So that was $86 billion of the claimed $143 billion of deficit reduction in the first 10 years, correct?
The original estimate, yes.
Right.
I think that's,
and the original estimate for deficit reduction,
yeah.
The original estimate for deficit reduction in the first 10 years was $143 billion, correct? So now we've
yes.
We've reduced that $143 billion by $86 billion by not getting revenue from the Class Act, and now $111 billion because we've increased the mandatory cost of the exchanges, correct?
I'm assuming the numbers are correct. I'm sorry, I don't have them.
So when you add those together, that's $197 billion added to the first 10-year cost estimate of Obamacare. So now we are, instead of saving $143 billion, we are adding $54 billion to our deficit, correct?
Sir,
we'll submit that to the record, but that's basically true. So instead of saving $143 billion by this administration's own figures and budget, we are now adding $54 billion to our deficit in the first 10 years. To me, that'd be the first broken promise. It is true that the President said that by enacting this health care law, every family would save $2,500 per year in their family insurance plan, correct?
He said that once the exchanges are up and running and you have an affordable marketplace, the insurance estimates were that the rates would go down by about $2,500. Yes, that has not occurred yet.
The Kaiser Family Foundation has already released a study saying that average cost of family health care plans is up $2,200, correct?
Again, there is no new marketplace yet for insurance
but costs
policies.
are already up. I mean, we're already different by $4,700. It's going to be hard to get us down to $2,500 cost savings. I would consider that broken promise number 2. It's also true that President Obama very famously said, if you like your doctor, you will be able to keep your doctor, period. If you like your health care plan, you will be able to keep your health care plan, period. No one will take it away, no matter what. We've granted quite a few waivers, about 1,200 to 1,700 waivers on about 4 million Americans, correct?
I have no idea what waivers you're talking about, or
those are waivers
on doctors and health plans. Is that?
Just waivers from having to implement portions of the health care law that probably would have allowed those or forced those workers off their employer-sponsored care.
Again, I'd be happy to answer these questions. I have no idea what waivers you're talking about.
The waivers that HHS has granted to employers not having to implement sections of the health care law.
There have been waivers granted to employers, yes.
And had those waivers not been granted, chances are those employees probably would have lost their employer-sponsored care, correct?
I have no idea.
Well,
I'm happy to answer those one at a time and look at the waivers and see what.
Yeah, well, unfortunately, I'm pretty short in time. The CBO alone estimated that 1 million people would lose their employer-sponsored care. Now, I think that's a wildly underestimated figure. The McKinsey Group has surveyed employers and said that 30 to 50% of employers plan on dropping coverage as soon as the health care law is implemented. Douglas Elmendorf, I think, has even admitted that that's credible evidence for him to retake a look at that estimate. The decision an employer is going to have is pretty linear. They can pay $15,000 for a family plan or pay the $2,000 penalty. And they're not exposing their employees to financial risk. They're making them eligible for $10,000 subsidies if they make $64,000 household income. Are you sure that only 1 million people, will lose their employer-sponsored care? Last year you said there are 180 million people that get coverage through their exchanges. Are you certain that only 1 million people are at risk of losing their employer-sponsored care and get put in those exchanges?
Sir, you're quoting a CBO number. All we have to go on is what's happened in Massachusetts, where actually more people have coverage today with the exchange, with a very similar framework than did before. They haven't lost employer coverage. More employers have come back into the market. So the practicing application of a state-based exchange on the ground with similar penalties and a similar framework is employer coverage rose. It didn't decrease.
It's not similar because those employees lose coverage for 6 months before they're eligible for the exchanges, and there aren't these types of subsidies that make it create a huge incentive for employers to drop coverage and make their employees eligible. I mean, bottom line here, this is the cost of this health care law is so uncertain. Don't you think we maybe ought to put the brakes on it? You know, Nancy Pelosi said we have to pass this law to figure out what's in it. What I don't want to see is that we have to implement it to figure out how it's going to bust a hole in our already horribly broken budget.
Well, I would just say, Senator, the statistics you gave on the rising health care costs for families and small business owners that Kaiser put out recently is the very reason that we desperately need a new insurance market. The private insurance market is basically on a death spiral where younger and healthier people are dropping out, where small employers who can't afford to pay 18% more than their large employers are dropping out. Doing nothing is really not an option. We now have 50 million uninsured in this country, and that number has gone up year in and year out, and the costs continue to rise. So a new market with competition, putting people in a larger pool, making companies compete on the basis of price and quality, not who can lock out folks with pre-existing condition or drop them out or drive them out of the market, is desperately needed by millions and millions of Americans, which was part of the driving force of passing the health care law.
Madam Secretary, if 50% of the employees lose their coverage, that'll cost us $500 billion a year, not $95 billion. Thank you, Mr. Chairman.
Thank you.